Hello and welcome. Thank you for tuning in. I'm Dr. Smart with Smart Skin Dermatology, and we're talking about CO2 laser resurfacing. So, CO2 laser is an ablative laser, which means it actually can vaporize tissue, which means it's on the more aggressive side. CO2 laser is the best possible treatment to improve the texture of the skin, whether that's loose skin around the eyes, or neck, crepiness of the eyelids, deep lines, and scarring. So tightness of the skin, texture of the skin, pore size, deep lines and wrinkles, or even fine lines and wrinkles that you want to be aggressively treating. That's what CO2 laser does, texture improvement. So the ideal candidate for a CO2 laser is looking for texture improvement to the skin, not necessarily coloring brown patches, even though the CO2 laser will improve brown spots, both flat brown spots and brown spots that have a little body to them. But the difference between the CO2 laser and another treatment of those brown spots is that those brown spots can be treated effectively with less aggressive methods oftentimes. The CO2 laser will treat brown spots and brown pigmentation for most people, but it will also and uniquely treat the texture of the skin. So, back to the ideal patient for a CO2 laser. If you have crepiness or looseness of an area of the skin, or lines, fine lines and wrinkles, or even deeper lines and wrinkles that you want to improve as much as is physically possible, then from a laser perspective, the surface of the skin, you want to do a CO2 laser and CO2 laser resurfacing specifically, or aggressive laser resurfacing. Nothing will improve the texture of the skin as well in as short a time as a CO2 laser. Now, the downside to aggressive laser resurfacing is there is more downtime. After a CO2 laser, to help treat and improve texture, you are missing the top layer of skin for a time, usually around 5 to 7 days. But for that time frame, you are oozy, you have an open sore in the area that the laser is treating you. It's fine, it's precise, it's not that deep, but it is technically an open sore. You are oftentimes unrecognizably swollen. So after a CO2 laser treatment, you want to plan on looking very rough and not just taking time off of work potentially, but time off of life. After a CO2 laser treatment, you look pretty scary, and I'm very upfront with patients about this, that you will look like a burn victim zombie monster, you're really scaring children, don't worry about any of that, that's normal. However, the results with regard to the texture and tightness of the skin, nothing will do a better job for the surface texture of the skin than CO2 laser resurfacing.